Hello and welcome to Afrik-innovscience, the channel dedicated to promoting science, technology, and engineering across the vibrant continent of Africa. Today, we have the honor of delving into the world of applied epidemiology, infectious diseases, and public health research with an inspiring expert, Malizgani Mhango. He is a dedicated professional with a rich background in the field, focusing on improving public health outcomes. Let's dive right into this insightful conversation. Can you please introduce yourself and share a bit about your background in applied epidemiology, infectious diseases, and public health research, please?
Okay, thanks, Patrick, for having me. My name is Malizgani Mhango. You can call me Maliz for simplicity so that you won't be troubling yourself in pronouncing my name. So I'm a Zimbabwean, currently a resident in Australia and currently in the field of applied epidemiology or field epidemiology training program, as they call it in other countries. So I've got more than 12 years of working in medical laboratory science. So I'm in the process of transitioning from medical laboratory sciences into applied epidemiology or public health research. And I've been working with infectious diseases for a very long time during my stint in Zimbabwe, Namibia, and Rwanda, and in Somalia at some point. So in this aspect, I've worked with the Center for Disease Control. I've worked with the International Center for AIDS Prevention when we were working on the Namibia population-based HIV impact assessment, where we were assessing the impact of the program that the USAID had done in Namibia to see how far has it gone in controlling the HIV epidemic. I've also worked with Population Services International as a senior medical laboratory scientist there. During that time, I was working with what they call the DREAMS project, where they were supporting young adolescent girls and women in order to have them be empowered, be knowledgeable, and also be resilient and be knowledgeable in terms of transmissions of sexual transmitted diseases, in terms of HIV/AIDS. And we're also introducing what they call the PrEP, which is now, I think, a very common thing in Africa, pre-exposure prophylaxis in HIV/AIDS. So we were working with the Family AIDS Caring Trust. We were working with PEPFAR. We were working with USAID in that project. So as a scientist there, I've been working with the Opportunistic Infections Clinic as well as managing people on antiretroviral therapy, doing HIV viral load testing, doing TB testing, also early infant diagnosis testing. So I've quite had a long experience in working with infectious diseases as a medical laboratory scientist. But I started moving on into public health. I'll just say maybe just after the Namibia population-based HIV impact assessment. So that's when I started doing some postgraduate studies so that I'll be able to gain more experience into the public health sphere. So that's like my background from medical laboratory sciences, public health, HIV and AIDS management. And now I'm working as an applied epidemiologist or a field epidemiologist.
Wonderful. What a rich experience. Wonderful. Malizgan, how did you transition from being a medical laboratory scientist to specializing in field epidemiology and public health research?
Honestly, I wouldn't say I have transitioned completely into public health or applied epidemiology, but I'm in the process of transition. My transition is one that has taken longer than what other people or other professionals do, because of the bottlenecks that really happen when you are in Africa. Sometimes you might not get the experiences, you might not get the opportunities. So my transition started back then in 2017, after the Namibia population-based HIV impact assessment. I would say during that time, that's when I had an epiphany of saying, okay, what should I take my professional career into? So I had the opportunity of meeting quite a number of professionals, because it was a multi-stakeholder project which had the International Center for AIDS Prevention, ICAP, at Columbia University. It's at University of California, San Francisco. We had also the CDC Atlanta team coming in to do trainings and also to monitor. So during this time, I met a lot of public health professionals, epidemiologists, data analysts, biostatisticians. And, you know, from talking and working with them together, because I was the regional laboratory supervisor there. So I would be working with the field teams, because we're doing like what they call a bio survey, where we would collect data and also collect samples from the field. So during that time, I met all these people, and talking to them and having chats, and when they were training us and all that, that's when I realized, okay, I may pivot my career into like a lot of things. But public health research was something that came to mind at first. But it was difficult for me to go into, to get a master's of public health, like straight away from there. I tried some other unis, so I didn't manage to get through. So what I did is I studied as law. If you see my profile, it's got a postgraduate diploma in HIV and AIDS management. So I started with a postgraduate diploma in HIV and AIDS management. And during that time, I got like some insights into research, monitoring and evaluation, the corporate and social responsibilities that has been happening in Africa in terms of controlling and mitigating the devastating effects of HIV and AIDS. So after completing the postgraduate diploma, I went on now to say, okay, now I've got a foundation where I can jump into public health research. But before that, I said, okay, I just have to complete another qualification in HIV and AIDS management, since I had also worked in a lot of HIV and AIDS programs. So I went on to do a Master of Philosophy in HIV and AIDS with the University of Stellenbosch. Then I also enrolled with the Master of Public Health with the University of Western Cape in the same year in 2020. So when I applied for those, I thought maybe I might not get one, or I might not get, so I ended up getting both of them. Then I told myself, okay, I got this lucky now, so why should I stop? So I embarked on those masters at the same time, concurrently. And I managed to complete the Master of Philosophy in 1 year, because I had much rich information of HIV and AIDS. So it was more like a walk in the park for me. So now I have the Master of Public Health with the University of Western Cape, which I had put on a break last year because I had to move from Africa to come here to Australia. So I'll be submitting my thesis now to complete it, but I've done all the coursework. Then now when I arrived here, getting my foot now into this space of public health research or applied epidemiology or anything that had to do with public health, there was some where you see that they are saying you don't have the Australian health experience, so you need to work in Australia so that we'll be able to employ you after you know what happens. Then I was like, okay, it's fine. So I worked as a medical laboratory scientist. I went back again to medical laboratory scientist for 1 year. So from February 2022 up until January this year, 2023, I was working as a medical laboratory scientist in one of the public health hospitals.
Wonderful.
So yes, so during this time, I was looking on what to do to enhance my career as a public health professional in Australia, or epidemiology in Australia. Then I did some search and I did some my homework, and I found out the Master of Applied Epidemiology or Master of Field Epidemiology training program, which is offered in Australia. So I applied for that, and I managed to get in last year, and I started this year. So now I'm currently doing a Master of Applied Epidemiology, and it's a more like scholarship kind of thing where you won't be sitting in the classroom. You just go for 3-week course blocks, 2 in the first year. We've already done the 2, and 1 next year. Most of the times I'll be at my work placement. So I'm currently placed at what they call Australian Capital Territory Health. I'm working there as a public health officer, as well as a Master of Applied Epidemiology scholar, where I'm working using their data, using their public health system to implement some interventions and also to analyze some data and end up with some reports and my thesis, which has got a number of projects that we may be talking later. So the transition was a long one for me to be where I am now. But I've learned a lot over the years, and I've realized that medical laboratory science is really a good background if you want to go into epidemiology, because it really gets you the understanding of infectious diseases. It also helps you in understanding the diagnostic part of the diseases, which most of the clinicians, they don't really have a grasp on, and it's a great foundation.
Wonderful.
I found it vital to my epidemiology training. Yes.
Wow, your transition is really interesting. You made so many things in your new field of work as a public health expert, because before that you were in the laboratory field, medical laboratory, and to be in Australia using their data to do what you are doing right now, you must really know what you are doing. My wish is in the future, you will use your skills, the skills you are developing right now in Australia, in Africa. It can be in Zimbabwe or Cameroon, why not? So in your current role at ACT Health in Australia, right? What specific projects or initiatives are you involved in that contribute to public health and the control of infectious diseases, apart from what you have just mentioned right now?
Okay. So, like I mentioned just before, that I'm designated as a public health officer. So the day-to-day jobs of a public health officer in ACT Health or in some other jurisdictions in Australia as well is working with the team. We've got public health nurses, we've got public health registrars, we've got epidemiologists, directors of surveillances and surveillance officers and all those. So my day-to-day now information is following up notifications. So what happens is when patients go to the doctors, to the hospitals, and they are tested and they get tested for positive bacteria or viruses that are notifiable in the jurisdiction, we do follow-ups to see if there is an outbreak that is happening somewhere. For example, salmonella. So we do follow-up salmonella to see if there is what do you call it? Like a food outlet, a food outlet or a restaurant which is implicated in an outbreak. So we're trying to make sure we manage the affairs of the infectious diseases. And I'll also do in hepatitis A, syphilis, gonorrhea, in all those. So we try to follow up and see if there's no pattern that can also help us to identify outbreaks, to identify new variants or new strains that are coming in our jurisdiction. So
Malizgani, I want to add something on what you are saying. It's the same thing in the medical device field. We have what we call post-market surveillance, so post-market clinical follow-up. We have to follow up how the medical devices are going on in the market. The users have to tell us if there is any problem. The distributors have to tell us if there is any problem. We record the serious adverse events of the medical devices. And if it's so serious, then we have to communicate it to the authorities. So it's really interesting what you are doing. You are really doing the follow-up, which is very useful to make sure that the product, or in this case, the diseases, or I don't know, we not have any danger for the society.
Yes. So we do this like almost every day. So this is part of what I do as a public health officer. But on the other hand, I am a student, so I'm doing my projects. So on my project, I've got I have to do like 4 competencies. They would call key competencies that I'm doing. So the other one that I've just done recently, which is almost completed, I'm almost about to publish the paper. I did an investigation into an outbreak of what they call a multi-drug resistant organism at a certain hospital. I may not say the names because it's something that is not yet published and not yet out there. So I investigated the outbreak, and we do investigate the outbreak, find the source, identify any contacts, and also try to provide mitigating measures and also interventional measures, and also train the people so that it won't happen again. You see, so I've investigated an outbreak. So they call it an outbreak investigation. So I've done that one and completed it. So I'm writing the report now. And the second one is I'm working on a project of evaluating a surveillance system. that is used in the Australian Capital Territory. It's an enhanced surveillance system for people who have been found to have Neisseria gonorrhea. So I'm evaluating this system that they've been using since 22. It's a new system. So we want to see how best has it been working. Has it been answering what we need? Has it been gathering the necessary information that can inform policy or that can inform any intervention or any mitigating measure that we may have? Or has it helped in identification of any clusters or any new infection that we may not have like anticipated, you know? So I'm evaluating that system. And the third one is I'm working on trying to link what they call whole genome sequence data for Neisseria gonorrhea to link it with the epidemiology to see, okay, there has been a shift in the past 5 years. We've been seeing more heterosexual males coming out positive notifications of Neisseria gonorrhea. So what has happened? Has there been a new strain that has been introduced in our jurisdiction that we don't know? So we can only identify this by using the epidemiology data, but the epidemiology data has got limits because it doesn't identify the sequence or the strain or the variant of Neisseria gonorrhea that is coming. So that's where I come in with the whole genome sequencing data. So I will be linking these two now to say, okay, we have 450 cases this year. So from these 450 cases, are they all locally acquired? Or it's a strain that has come from Europe, or it's a strain that has come from another country? Africa. So this is what I'm trying to identify, like identify any temporal spread that has happened, or to identify if there's any strain that is like prevalent at a certain particular location. Because I'll also be using the geographic information system to pinpoint the locations of saying, okay, this strain is concentrated here. Has there been something happening that we don't know? Do these people need more information? They need health education. They need health promotion. So this is where what we are trying to do on this other project. And the fourth one, the fourth project, I'm working on a validation of another surveillance system for influenza that we'll start using next year. So I have to validate and have it approved before the influenza season next year. So I'm using laboratory notifications data to validate this syndromic surveillance for influenza-like illness. So this is what I'm doing currently at the moment for the next year, up until December next year. And it's quite interesting. I've got all the support these people, my colleagues are giving me, and my supervisors and some other classmates and everyone. So it's quite like a big team of people, and
wonderful.
It's working quite well, yes.
And what are the some of the challenges you have faced in your career, particularly in the context of resource-limited settings, and how have you overcome them?
I think you might have heard me saying I've had a very difficult, long transition from just being a mere medical laboratory scientist to becoming someone who is working in the public health sphere. So one of the challenges that I've seen that happens, especially in Africa, in the country that I've worked, it is something to do with opportunities. The opportunities are so few that at times we tend to squeeze others, you see. Not that we don't have the problems in the public health sphere that needs more people. No. But it's the issue of, I would say, funding. That's the first thing. There is no money available in the research and development sphere in Africa. There's an agreement globally of saying, I think 15% or whatever of the GDP should be invested in research and development, but it's not happening in Africa. Case, yeah. Yes, the reason is, so at the end of the day, people like me now, even though we want to help our continent, we struggle. But when I come in an area like this one, I get the opportunity that I need to flourish, to also get into this. So my submission in terms of how I overcame this is I just continued knocking on the doors, you know, tried. I'm taking the longer route, but in the end, I'll get what I want. So the challenges that they will always be there, but they are there to be overcome. And maybe one of these days, when we become the leaders, we'll be able to say, okay, we encountered these hurdles. So we have to find a way to put more funding in our health systems so that we have more. We introduce many training programs. So was that another thing? In Zimbabwe, we find that there's only one university that trains a master of public health. And it's all given to only the doctors and the clinicians. Medical laboratory science, physiotherapy, social scientists, psychologists, they don't get that chance, you see. It's not that they are not knowledgeable enough to train in master of public health. No, a university trains skills, so anyone can go there and be trained to be a skilled somebody who end up helping in every part, because public health is not clinical, as we have seen over the years. It's something that is, yes.
When I hear what you are saying, I want to say something. Look, what you're saying is very, very interesting. We lack funding in so many projects in Africa and the scientific field. And it will be very good in the future that we have leaders with scientific backgrounds, with backgrounds in engineering, so that they can easily understand the needs of the researchers. If you have as much as possible leaders who have the knowledge of the scientific projects, I think that it will be easier to implement, to fund the researchers, giving them the resources they need to continue their research. Because if someone doesn't have any scientific background, he will be impatient, because sometimes the results of the research come like 5 years or 10 years, and to continue funding such projects, it is very important to have the knowledge about it, knowing that it is important, not just for the country, but also for humanity. Because look, yes, you are in Australia, but you come from South Africa or Zimbabwe. The Australians know that even though you were not born in Australia, you have the skills to help them. You are helping humanity. You are not just helping Africa, you are helping humanity. It's at the end of the world, the other side. Right now, it's like 7 p.m. there, and here it's like 10 a.m. Look, what you are doing is very, very fantastic, wonderful. Malizgani, I don't know if you have anything to say again about your challenges. My wish is that you could advise, what advice would you give to aspiring public health experts, particularly those interested in the field of infectious diseases and antimicrobial resistance?
Oh, yes. As someone who is now versed into this thing, like just recently, I've just completed drafting the antimicrobial resistance strategy for this state that I'm staying in, the territory that I'm staying in. And I've also designed another surveillance system that we are working on for hepatitis C. So what I would say is to someone who's aspiring to be a public health professional is to keep on knocking the doors and get the trainings that are necessary. Networking is very important, because I found networking to be one of the pillars that is brought to me to where I am today. Because you get insights, you get advice, you get knowledge, you get wisdom from the people that have done it, people that have seen it, be it people who have worked in the field, be it people in policy who implement policy, be it people who are in the leadership positions. So that's the words that I would say to anyone wanting to really venture into public health, to say, okay, do those qualifications, do those certifications, online trainings that are free all over now. There's a lot of trainings. You can get skilled more than someone with a degree in less than 2 years or something, just by doing it freely online. I've done a lot of courses online, and it's something that is of interest to me to say, okay, we have people who don't have the fees or the money to pay for traditional degrees, but if you've got connection or connectivity to internet, you can be whatever you want to be. You can gain the skills that you want. And there are organizations that there are mentors that would like to take people on their wings and help you to guide on to be whatever you want to be. So that's my submission to say.
And you know what you're saying, because you have so many certifications.
there are just too many, because during lockdowns in COVID, I realized, okay, should I just stay home and not do anything? I'm like, okay, I would rather use this time. And because if you see most of them, it's like 2020, 2021. Even my publications, most of them, they are 2020, 2021. Because that's when I realized I've got time to read, I've got internet, I've got a computer, I'm literate. So why not? So anyone can be that. Anyone can amass that knowledge and that education to be able to contribute to the public health sphere or applied epidemiology or any other field that one might need, especially yours in the in vitro diagnostics. I even at one point wanted to go in that field because as a medical laboratory scientist, we deal with you guys a lot. When our machines break down, we call like service engineers. I know you work with them, and also distributors of reagents, default reagents that are not the lots that are not working and all that. So it's just a matter of having the right person who you say, okay, this is the type of person that I want to look up to. Can they guide me to be where I want to be?
Wonderful. Finally, could you share a few last words or a message to our audience before we conclude this insightful interview?
All right. Thanks, Patrick. My last words, I think I'll just say, people should not be intimidated by their dreams. It may take long. You may take 10 years, 12 years to be a public health professional like I did, but it's something that is doable. Like, the famous words from Richard Branson. He said, if your dreams do not scare you, they are not big enough. So you may be in Cameroon, in Africa, in Zimbabwe, but with the connectivity, the globalization of the world, you can be whatever you want. Utilize the power of connectivity, mentorship, put in your hard work, you persevere, and you're determined. I believe it's something that you really get to be where you want to be. I think you can attest to that. If you're Cameroonian and you are in Germany there, maybe at one point you had difficulty learning the German language. It's something that, but you took upon yourself and you're good with it. You're working very well with it, and you thrive in such an environment because you are determined to. So any child, any professional can dream to be what they want to be, despite all the background. Because sometimes backgrounds, challenges, backgrounds, barriers that happens to us. Because if you go to Africa right now, some may say, I may not have the fees, but you've got a smartphone, which has got the internet. Sometimes you get internet. Sometimes you get books, libraries. Utilize it. They will help you one day, And I think the best of all that I can say is read and more reading. It's something that I think there's a saying that says reading is how you install knowledge in your mind. I don't know if I said it correctly, but it goes like that. So,
thank you so much. Thank you so much, Malizgani Mhango, for sharing your wealth of knowledge and experiences with us today. Your journey from a medical laboratory scientist to a specialized expert in epidemiology and public health is truly inspiring. So our viewers, we hope this conversation has shed light on the critical role of science and research in addressing health challenges in Africa and in the world. Don't forget to like, subscribe, and share this video to spread the importance of science, technology, and engineering in our communities. Stay tuned for more enriching interviews on Afrik-innovscience. Until next time, keep innovating, keep exploring, and keep advancing science in Africa. Goodbye.
Thank you very much, Patrick. Bye.
Goodbye.